do everything to make him satisfied.
You just look good, you know you're in love.
I am in love.
You got to face it, the light up above. You take the good along with the bad. Sometimes you're happy and sometimes you're sad.
One more time.
You know you love him,
I
but
wanna
you
know
can't understand why he treats you like you do, and he's such a good man.
I was diagnosed with breast cancer in 2007. I felt like that cartoon dog that hears blah, 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 cookie, and all I heard was blah, 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 cancer. It was really scary. The nurse navigator called me to set up an appointment to talk about treatment options and to really let me know what to expect.
I'm a breast cancer nurse navigator, and the main purpose of this role is to be a support person for the newly diagnosed breast cancer patient and continue to be that focal point during the whole diagnostic and treatment process. And we try to meet with her the same day just to kind of help her settle down and understand her diagnosis and prepare for the next steps.
We talked at length about options, and I felt like I was going to be fine as a result of that. I stopped hearing cancer and started hearing health. I was really lucky. I was diagnosed with stage 1 cancer, which meant that I had some pretty good treatment options. The surgeon that I met with recommended a lumpectomy. I met with my radiation oncologist, and she explained the whole process to me and really demystified preconceived notions that I brought with me.
Many of our patients, like Carol, come to us having had a lumpectomy, surgery to remove the breast cancer and a small rim of normal tissue, and they're here to learn about radiation therapy, which can eradicate any breast cancer cells which may remain in the rest of the breast. When a patient is ready for radiation therapy, we bring her in for simulations. We want to position a patient very comfortably but very reproducibly. So if a patient is in her cast and lined up in the exact same position, both for treatment planning and ultimately for treatment each day. We then get a treatment planning CT scan.
A medical dosimetrist works with the radiation oncologist in devising a treatment plan for a course of radiation therapy. My treatment planning computer allows me to set up the patient in a virtual world in the treatment planning setting. So I can generate beams and pinpoint them at certain angles where I'm maximizing the dose to the tumor, yet minimizing the dose to all the surrounding tissues.
I had to do what is called gated breathing because we wanted to make sure that my heart and lungs were out of the way.
What this meant for Carol and for our left-side breast cancer patients is that we can see exactly where she is in the respiratory cycle. And when she's at the same place in a deep breath hold, we can turn the radiation beam on so she gets all of her treatment during a deep breath hold when the heart is far away from the radiation beam.
It turns out that it was really easy to do. I just would hold my breath, have my treatment, finish my cup of coffee, and go home.
This is our treatment room. This is where you'll be when you come in each day for radiation treatments. We'll set you up on the treatment couch into the special mold that was made in CT planning. After the doctor has verified your position, what we'll do is we'll make sure that we've lined up under the gantry. This is where the radiation comes out. And then we'll move the gantry into position to get ready for your treatment. Time in the room is about 10 to 15 minutes. It's pretty quick.
After treatment ended, I recommended that Carol participate in Stepping Out to Celebrate Life, which is a fundraiser, a fashion show. It's put on by women who've had breast cancer who are remarkably supportive of each other and of the women who follow them.
There were 35 of us, and all of us were in some stage of breast cancer treatment, and none of us had felt very pretty for a while. You can imagine, you just don't feel pretty going through all this stuff. But this night, at this event, we all felt really beautiful, and everybody in the audience was somebody who loved us. God, you just couldn't miss. It was perfect. And it moved everybody who attended, everybody who participated, everyone who volunteered. It was magnificent. And the best part was that we raised a lot of money for women who came behind us.
We now see Carol in yearly follow-up. It's been 3 years and she's doing beautifully. The vast majority of our early stage breast cancer patients go on and have normal rest of their lives.
I've learned to pay attention in new ways as a result of this. So I just encourage anybody who, gets a funny looking box, take the lid off, look inside there. You'll be surprised what you find. I feel so lucky.
Bye.